Welcome back to our Dental Spotlight. I'm Dr. Sharma from Provident Dentistry.
And hi, I'm Renee. I'm a hygienist at Provident Dentistry at Canton Park. Today we are going to be talking about why do I need a cleaning appointment every 3 to 4 months. For some of our patients infected with periodontal disease, which is an infection of the bone and the tissues and the gums around the teeth, they need to come back more frequently, about every 3 to 4 months, which is an American Dental Association recommendation. These cleanings differ than a regular routine 6-month visit because we are cleaning far below the gum line where bone loss has formed, which happens with periodontal disease. The hygienist will clean far below the gum line to remove plaque, bacteria, tartar that contributes to the gum disease.
Yeah. Studies have shown that these harmful bacteria form in these deep soft tissue pockets between your teeth and the gums. They usually return after 12 weeks or 3 months after your initial cleaning. And that's why it's very important to get these bacteria removed before it causes any more further infection and disease.
Bone loss associated with periodontal disease is the most common form of tooth loss in adults. If you have diabetes, heart disease, or are pregnant, it is especially important to follow up with your periodontal maintenance appointments because active gum disease can exacerbate these conditions.
A lot of times people ask that, why do I need a cleaning done every 6 months? According to the American Dental Association, they recommend to have a routine cleaning, which is every 6 months. If not, there's a hard deposit called as tartar, which is deposited on your teeth, and that tends to attract bacteria and plaque, which causes gum disease. And that's why it's very, very important to have a cleaning done every 6 months.
Yes, and once that tartar forms, you can no longer get it off with a floss or brush, right? You have to get it off with instruments in the dental
And when
office.
that gets deeper, it causes the gum disease, bone loss, and then you need a deeper cleaning, which is then every 3 to 4 months.
Right. When you have your 6-month routine cleaning, we are not just doing a cleaning. We are checking for tooth decay, we do an oral cancer screening, and we check for gum disease, which again is much easier treated in the early stages.
Absolutely. In summary, make sure you have your cleaning done every 6 months. That's very, very important.
Yes. If you skip your cleanings, that can lead to the gum disease that we talked about, and that can include more frequent cleanings every 3 to 4 months. It becomes more expensive. You'll need more treatment. So every 6 months is the way to go.
If you have any questions, please don't hesitate to call us. Thank you.